to do discharge instructions. In this scenario, I am a RN that works for the NEIT Urgent Care. My patient's name is Sandy Dunes, and the MD I'm working under is Dr. Sun Burns. Hi Sandy, my name is Victoria. I'm going to be your nurse for today. How are you?
Good, how are you?
Good. I see that you came in for burns on your upper extremities and your lower extremities, which is your both arms and your legs. Is that correct?
Yep.
And how did you get these burns?
I was at the beach all day in the sun.
You were at the beach all day?
Mm-hmm.
Yeah, that'll do it. So it looks like you have a first-degree burn, which is also called a superficial thickness burn. That means that the first layer of your skin, which is called the epidermis, was affected. Your skin has 3 layers. It has the epidermis, the dermis, and the subcutaneous layer. So the epidermis was the only layer affected with a first-degree superficial burn like this one. And sun exposure will definitely do that to you. Long-term sun exposure, especially from the sun or any UV tanning beds. Your dermis layer that I mentioned, your second layer, and your third layer, the subcutaneous layer, are both intact, still have their blood supply, so that's good. But your skin is definitely compromised for any infection. So when you are touching your skin at all, make sure you're washing your hands or using gloves to prevent any infection in your body. That's a priority in burns as well as pain. So out of a pain scale, you said it was a 4 out of 10 earlier, so that's mild pain and that's normal within these type of burns. What we're going to discharge you with is a NSAID. It's just going to be aspirin, 325 milligrams as needed for pain. I also suggest putting a cool washcloth on your skin. That'll help with any pain that you have, and it will cool the burn off for you. You also mentioned that you have a tingling sensation in your skin. Is that correct?
Yeah.
So that's normal within these type of first-degree burns too. The first thing that I did when you came in here was making sure that you're breathing okay. Your respirations are at 16, so it looks like you're breathing fine. You're not having any trouble breathing, are you?
No.
Okay. If you do have any trouble breathing, such as shortness of breath or it's hard to catch air, make sure you call your healthcare provider or you go to the ER. With burns, especially on your chest or upper part of the body, we're very concerned about acute respiratory distress syndrome. So those are signs of like shortness of breath or having trouble breathing at all or trying to grasp some air. And I also want to take some of your labs. So the labs that I'm going to draw is white blood cells, your ESR and C-reactive protein, which those will tell me if you have any inflammation. Your white blood cells will tell me about if you have an infection from the burn at all. But usually with first-degree burns, your lab should be fine and within normal limits. It's second-degree and third-degree burns that we're more concerned with those. And your labs came out fine, so you're good. Your vitals came out fine too. So what I asked you, Larry, about it's very important as a nurse that I ask how long you were in the sun for, where you got the burn from, the duration, like I said, how long you were in the sun, the source of the burn, where it took place, and how it happened. How I determined the severity of the burn, how I determined if you had a first-degree burn or a superficial thickness burn, as it's called, was I looked at your tissue damage or your skin damage and the overall area of your body that it was damaged. So that's how we get the severity of the burn. Also, as you noticed, when I was touching your skin or the burn, I used aseptic technique, which means I made sure I washed my hands or used gloves to prevent any infection to that burn. Before you discharge today, I'm going to provide you with education on how to prevent burns like these and how to manage your burn at home. So the Dr. Sun Burns prescribed you with a non-opioid analgesic, which is aspirin, 325 milligrams as needed for pain. And I also suggested that cool washcloth to put on your skin, making sure it's sterile water, and you're washing your hands and putting gloves on when you do touch those burns. You also want to watch for any signs of infection. So these signs will be redness around the edges of the burns, discoloration, which is getting even more red or brownish color, Any drainage on your burns that look yellow or greenish could be a sign of infection. If you have any chills or a temperature, you want to go to the ER or call your healthcare provider immediately, because we're trying to prevent any infection in your body, which can turn systemic, meaning that the infection can turn really bad really quick. To prevent any pain to your body, you want to maintain in a neutral position. So basically you want to lay down on your back and limit any movement in your extremities, because as you noticed, if you move your extremities, it causes you to have pain because it's bothering the burn. I already talked about any signs of shortness of breath, or to call the healthcare provider or go to the ER immediately. Let's talk about preventative measures for these type of burns or any sun exposure. So when you're in the sun, you try to want to stay out of the sun from 10 a.m. to 4 p.m. That's when the sun's strongest, and the UV rays will definitely affect your skin. If you are outside, especially for your job, you want to make sure that you use sunscreen every time and reapply when needed. You want to protect your eyes from the sun, so use sunglasses. Stay hydrated at all times, especially outside. You get dehydrated very fast. So if you have any dry mouth or you notice that your skin's dry, make sure you drink water as soon as possible. Avoid any use of tanning beds. I don't know if you do that. And use clothing to cover that skin up, especially while you already have a burn. You don't want to make the burn worse. I want you to follow up with us in 1 week, which will be 8/21, to see how your burns are doing. These types of burns will usually heal within 3 to 6 days because it's a first-degree burn. You should have no pain, so 0 out of 10 from a pain scale. No redness around the extremities or inflammation. You shouldn't have any scarring with this type of burn. If it was a second-degree or third-degree burn, you might have some scarring, but you only have a first-degree. And your skin should be pink, dry, and intact. So I provide